Continuing our coverage of kids in crisis now, a new CDC report is showing that our kids, especially teenage girls, are struggling more than ever. According to the Youth Risk Behavior Survey, 42% of high school students reported feeling persistent feelings of sadness or hopelessness. In 2021, 57% of those teens were girls. That is up from 36% in 2011. 29% of boys reported the same, up from 21% in 2011. And an extremely alarming trend, 22% of high school students said they seriously considered attempting suicide in 2021. 30% of those were girls, which is up from 19% in 2011. 14% of boys reported the same, up from 13% in 2011. And joining me now to discuss the results we're seeing here is Dr. Patricia Westmoreland, a psychiatrist with Health One. Thanks so much for your time, doctor. It's good to see you.
Good to see you too, Michelle.
All right, so we just went over some of the results from the CDC report. What does this mean for our kids?
You know, it's so tragic for our children. Our children are exposed to so many more stressors than I think we were many years ago, and they're feeling that pressure. And unfortunately, the pandemic didn't help with that at all. And I think now that, the safety of the world we live in, the shootings that happen at schools, I think all of those things really contribute to our children feeling unsafe and untethered.
Talking about that and expanding on that a little bit, that could be what's driving this worsening mental health in our kids now, and especially here in Colorado. Why girls? Why are they affected more?
So I think with girls in particular, girls these days certainly grow up a lot more quickly than they used to in the past. They feel the pressures of social media perhaps a little more. They typically have a lot more to deal with in terms of body changes, and those changes are happening earlier and earlier. And I think certainly, although those factors affect boys, girls are a little more at risk. And I think playing into that is also that there's been a 20% increase in sexual violence towards girls in that same CDC report in the last 5 years. And so that is also alarming and awful, and very often leads to post-traumatic stress.
What do you recommend to parents who are worried about mental health when it comes to their kids?
I think the first thing to do is to be checking in with your kids. I have one teenager and one preteen, and even though they have their moods and even though they have their difficulties, I think always trying to check in with them to see if there's anything that you can help with. Try not to be judgmental. If you have any concerns, it's better sooner rather than later to seek help from your pediatrician or from a family therapist or an individual therapist. And thankfully, also here in Colorado, we have something called school-based clinics, and certainly kids can get support through schools. And there's a huge legislative drive to create more of that support.
So the results of this survey are scary, but looking forward, what would you say to a teen who feels like they're really struggling?
I would say, first of all, know that you're not alone. Being a teenager is really hard. Even if you have differences with your parents and feel that you can't talk to your parents about everything, at least check in with your parents. Let them know you're having problems, and ask them if they can assist you in getting help. And you can also go to a guidance counselor or teacher at your school if you really feel that you can't approach your parents.
Well, Dr. Westmoreland, it's always great talking to you. Thank you so much.
Thank you, Michelle.
All right. And remember, you can watch all of our health interviews right now on our website, cbscolorado.com.